afternoon, and thanks for joining us. I'm Judy Simpson. As we age, most of us want to stay living in our own home. In fact, studies on aging consistently show that living at home is better for the overall health of seniors. So today we're going to learn about a statewide program that helps seniors live independently. It's called SASH, which stands for Support and Services at Home. To find out more, I'm joined by the director of SASH, the SASH program, Molly Dugan, and also with me is Catherine Holdway. Catherine is a director of Community Care Connection for the Visiting Nurse Association of Chittenden and Grand Isle counties. The VNA is one of several organizations that are partnering in the SASH program. I want to welcome both of you, but first of all, Molly, let's start out by talking about what is SASH.
Great. So SASH is a community-based partnership between a number of provider organizations with housing organizations that are spread around all over the state. And these organizations have come together in a formalized way with the goal to close the gaps that sometimes emerge when people are trying to do just what you said in the opening, which is stay at home. As people are living longer, which is a wonderful thing that's going on in the state of Vermont, our aging demographic is going that way, and people want to stay at home. And as sometimes their health needs change or their functional limitations start to creep in, they're challenged by certain things, and sometimes it's not a huge thing. It's something relatively small, but they need to make the connections with the different organizations that have services and supports that can be provided. So what SASH has done is really connected these organizations in a framework that makes access to these supports and services for people living throughout Vermont much easier. And SASH also makes sure that we're focusing on, not just kind of reacting to an acute health episode crisis, but we put in place all around the state prevention and wellness programs that anyone can access who's participating in SASH, with the goal of, the best way to stay at home is to stay healthy and to stay active.
Right. And so, Catherine, who's involved in SASH?
Well, there's a whole team of people involved in SASH. The VNA is one of the members, or SASH is all across the state. So the VNA is involved in Chittenden and Grand Isle counties, and there's other home health agencies all across the state involved. And there are CVAA across the state is involved. The University of Vermont is involved, and the Health Center, University of Vermont Health Center. There are health centers all across the state. Now I need my quick notes. There are mental health organizations in our area. It's Howard, but there are other organizations across all over the state. There's 68 different organizations involved in SASH, so there's a real wide variety of community agencies involved. Did I miss anybody in our area?
Just the affordable housing organizations throughout the state kind of act as these local hubs where these services can kind of emerge out of and bring all the partners together, because there's over 200 affordable housing communities throughout Vermont, and it just seemed like a wonderful platform to reach all the different corners.
And so when did SASH begin?
So SASH began, we actually were in the planning stages back in 2008. And what Cathedral Square, which really kind of pioneered the development of this, reached out to our local partners here in Chittenden County, Catherine, the VNA, her organization, Howard, Champlain Valley Area Agency on Aging, as well as the hospital. We reached out to them, and we put together what we called the model design team. And we said, let's all talk about what we're hearing are the challenges out there for people to stay at home. And so we came up with some kind of bare bones ideas about what are the kind of key elements that people need to have in place. But then we said, what we really want to do is hear from the experts. We want to actually have seniors involved in designing this program.
What a good idea,
yeah. So we went out to one of Cathedral Square's housing sites in the New North End called Heineberg, and we had a group of 59 participants, residents there, that agreed to help us design it over the year. So we actually kicked off the pilot design in July of 2009 and spent a year with our partners and with that group of residents to come up with what are the real different parts of SASH that are going to allow you to age safely at home. And I tell you, they had lots of great ideas. There was no dearth of input from the residents, and I think that that's something that we've really continued to try to keep going on, is that we're always looking to our participants to give us, more input. Is there different challenges now than there were in 2009 that we need to respond to? So it's very much a participant-driven framework.
So where is SASH available and who can participate?
So we're at the point now, so we started with this one site in Heineberg in the New North End, and we are now scattered throughout the state. We are statewide. You have a map there that shows that.
That's incredible.
Yeah, so we actually have what we call 52 panels of SASH, and what I mean by that is a panel is up to 100 participants. So when you have SASH at all corners of the state like that, that means there's access to 5,200 Vermonters to be part of this program. And who's it available to? It's really what I think is so kind of innovative about SASH is that it doesn't matter kind of where you are on kind of the spectrum of health needs. SASH is available for you because we're going to work with you. All the organizations are going to work with you as a team to figure out, what are the goals that you want to set for yourself? Are you relatively healthy, and what your goal is that you want to stay that way? And so you need, some ideas about programming, or are you, quite frail and really need some more supports? I think the best way to kind of really understand who we serve is to actually hear from one of our participants. And we have a nice short video from Marie, who's in one of our senior housing sites in Jericho.
Okay, let's take a look at that.
Marie Salter, and I'm 81 years old. I think my biggest health challenge is my breathing. Of course, I smoked for years, and that's what's caused it. I try to be independent. I was brought up on a farm. We had things to do. You had to be independent. And I was a widow for 10 years, raising 6 kids. I had to be independent that way, too. Yeah, my health problems interfere with a lot of it. I can't do a lot of things that I used to. With Christy checking on me every week, I know if my lungs are congested, because lots of times I don't hear it. She can pick it up by listening. She checks my blood pressure, my oxygen level. Oh, my legs swell. She checks those quite a lot. She does a lot of things that I wouldn't think to ask a doctor, probably. I think having somebody on site like this is very good. I don't get the information from the doctors sometimes that I can get from Christy, from the SASH program.
We want to thank Marie for sharing her story with us. That's amazing. So obviously for her, that's great. She can be independent but still have that medical help that she needs on a regular basis.
Exactly, and that's really where we come in as an extender to the healthcare system. So every SASH panel, there's access to a part-time wellness nurse as well as a full-time care coordinator, and then there's this team of all the staff members from the different community organizations that come together monthly to really action plan and share their expertise. So in that segment, Marie is getting weekly kind of attention in a very wellness focused way, and the nurse can help her understand what are the warning signs that things might be going a little awry, and I need to be in touch with my primary care provider. And it's those kind of things that allow someone to stay at home longer. It's not rocket science. It's some simple face-to-face contact.
So Catherine, how do SASH partners like the VNA collaborate to help Vermonters like Marie stay at home?
Well, the strength of the SASH partnership is really that team that Molly just mentioned. The team works very closely on there's a slide of the team working together, and you see there the wellness nurse, the VNA nurse, the SASH coordinators, and they meet usually monthly. Some sites are they still meeting every 2 weeks. It varies more, from site to site, but they really meet and look at the most complex clients, and as a team, putting all their heads together with their various expertise, figuring out how to meet those needs on a case-by-case basis. And that's the real strength of the collaboration of all those different organizations working together, and they can meet those needs. So
it's not you're getting VNA services or SASH services, it's all together. So balance, of course, is a huge concern as we grow older, and more vulnerable to falls, and that can change someone's living condition in an instant. And I understand SASH has a special emphasis on falls and prevention.
Yeah, absolutely. Falls is one of those areas that is in the research, and it shows that people who start falling multiple times, it's kind of that domino effect where they're all of a sudden they're in the hospital, and then they're at a rehab facility, and and they get into this circular thing. So falls prevention was one of the things that was top on our priority when the program was developed. And SASH kind of goes at falls in lots of different ways. One thing that we do, I mentioned earlier, that we really focus on wellness and prevention programs. So one of the things that we've instituted is really working to make sure our SASH care coordinators throughout the state are trained in programs such as Tai Chi. And we have a picture of one of our coordinators out in the New North End who does Tai Chi twice a week, and her class is full. And what Tai Chi does is it helps with balance, it helps with strength. It gets, it does all other kinds of things too, like it gets people out of their apartments or their homes and gets them social, but it really does a lot to help with preventing the next fall. But then there's other areas, things you can focus on to reduce falls. I think medications is something that
one of the things that we look at the VNA is medication management.
Right.
And our skilled nurses go in when we're involved in the case, and we check people's medications. We teach them their side effects. We help them figure out ways to take their medication safely. And that's where we overlap with the wellness nurses as well, and figure out systems so that they can take their medications, figure out who's there that can help them with their medication. So medication management is really key.
I know we have an example of SASH providing direct support to Vermonters. We have another tape that you want to take a look at?
Yeah, so because I think, there's so many, people are just so unique, and so the services that SASH ends up providing through all the different partners that are on the team end up being very unique. So, in the clip that you're going to see, is a gentleman who actually lives out in the community up in Franklin County. So we also serve people not just in affordable housing sites, but we reach out to Medicare beneficiaries in the community. And he was, struggling to stay at home because he needed to figure out how to take care of a condition. So let's hear from Guy.
Okay.
Guy W. Hope Sr. I'm 78 years old.
Teresa May Hope, and I'm 77.
Raised a family here in the Franklin County area. Well, right now, of course, I have the lymphedema in my legs, which is really bad. And at the time that we knew that she was going to have to, Teresa was going to have her surgery, we had to find an alternative way to take care of my legs, because she's been doing it right along. SASH did search out every avenue there possibly was. And we ended up with a special thing that helped me put my socks on, and one thing, because I can't bend way down. But with SASH, they found the alternative. And that's the difference,
So, Molly, SASH has been available for 3 years now, and overall, what kind of impact is the program having?
We're really having a fabulous impact. We've been studied by a third-party evaluator that was hired by the federal government. Housing and Urban Development and Health and Human Services came together because they wanted to look at a housing plus services model. They looked at SASH, and we're particularly looking at, is there any kind of shift in health outcomes for those participating, and was there, importantly, any reduction in Medicare spending? And what they found after they looked at the first year, and preliminarily what they found was that the rate of growth in Medicare spending was quite a bit lower for the SASH participants than it was for the two control groups that they were looking at. They were looking at a group of similar people in upstate New York and then in Vermont, and by about $2,000 per participant per year, the Medicare savings. Other things that we've been able to do is we've been able to follow about 1,000 participants over 3 years now and look at their data, and we've seen some really wonderful things. We've seen vaccinations going up for those people. We've seen connections to primary care doctors increasing, increase in annual visits to primary care, and also reductions in falls. So just the kind of things that we want to see, and it helps explain those reductions in Medicare spending.
Well, why don't we tell Catherine folks, if they want to get in touch with the VNA, how they can do that, and then Molly, you can give the SASH information as well.
Yeah, they can they can call our main number at 658-1900 or our website at www.vnacares.org.
Yeah, and you can find out about SASH by going to our website, which is www.sashvt.org, or call our main office at 863-2224.
Well, thank you so much for coming on and sharing this very important information with our viewers.
All right, it's a pleasure.
Thank
That's
you.
our program for today. I'm Judy Simpson. We'll see you again next time on Across the Fence.